Hello and welcome to video number 2 of the De-Escalation Plan, Responding Effectively to Child and Youth Emotional and Behavioral Outbursts. This is Dr. Barnabas, PhD, Pediatric and Family Health Clinician, Nationally Certified School Psychologist, and Licensed Behavior Specialist Consultant here in the Commonwealth of Pennsylvania. So, just a quick review. We're talking about the De-Escalation Plan, the 5 S's, if you know these if you work together with me. Number 1, stop. Number 2, separate. Number 3, soothe. Number 4, solve. And number 5, set up for success. Right now we're going to be focusing on step number 1, stop. Specifically, some of the common mistakes that people make. We talked about that in our last video, the one where we focused on common mistake being arguing. That's one of the things we want not to do. Today we're going to focus on effective strategies or techniques to try. And in the following video, which will be video number 3 in this series, we'll focus on other points, which are helpful details, tips, and resources to enhance those techniques. So let's look at number 1, stop. What are we talking about here? For the child or youth, we're talking about learning to control impulses, to stop themselves when they're about to make an impulsive choice or decision that they're going to regret. Also, emotional awareness, helping them realize when they're starting to escalate and stopping themselves before it gets too intense and they lose control. We must also focus that this number 1 step also focuses on the parent. So, what is the parent supposed to do during this stop phase? Number 1, support and facilitate that child with impulse control. Help them realize, okay, I see you're getting mad, or help them make a decision if you can see that they're starting to become more impulsive or beginning to escalate. Number 2, label those emotional states. When they're getting stressed or impulsive, they're going to need a reminder about that their body's giving them some different cues, that it's time to stop what they're doing and think differently. And most importantly, and that's what this video series focuses on, preventing escalation at the earliest point possible in the escalation curve. So it's up to the parent to do a lot of work also in order to decrease these impulsive behaviors and emotional responses that we see. And how can we do that? Let's move forward to find out. We're talking about the build-up. If you work together with me, you've seen this chain of events sheet several times. We're working again on the things that lead up to an escalating problem so that we can prevent it from becoming too intense to control. So, when we're thinking about effective strategies and techniques to try, today we're going to focus on what some people call a precision request or precision directions. Some people call them alpha commands. I like to think of them as the 7 steps to following directions. So, what are we talking about here? Number 1, stopping and thinking about what we want our child to do. Number 2, reducing distractions to help them follow directions. Number 3, always being careful to say their name in order to get their attention. Number 4, using the word please or a respectful tone in order to teach and model respectful interaction. Number 5, verbalizing the specific action or behavior that we want our child to do. Number 6, having them repeat it back to us. And number 7, always following through with a positive or negative consequence. Or you might think of it as a reward or punishment, but they're all consequences, positive or negative. So, what is the first step to following directions? First of those 7 steps. Number 1, stop and think. What specific behavior activity do I want my child to do right now? Not what I want them not to do, not what I want them to stop doing, but what I want them to do right now. What do I want to see happen right now? What do I want to see them doing? Focus on starting something different. For example, maybe we want to see them go and put their dish in the dishwasher. Maybe you want to see them go and open the door to let the dog out. Maybe you want to see them go upstairs to start their shower and start getting ready for bed. Something like that, but help them focus on starting something different. We want to avoid stopping something current. Sometimes we'll have to use this, but the majority of the time we want to give a start type of command and avoid saying stop doing this, stop doing that, stop doing this, stop doing that. It's difficult for us, it's difficult for them, and it hurts our relationship, and it decreases the likelihood of compliance. So those stop commands are kind of take us away from where we want to go, while those start commands take us in the direction we do want to go with increased compliance for our child. What is our second step? Reduce distractions. Get close, proximity. Get within 3 feet of your child before you give a direction. Don't yell it from the other room when they might already be doing something or might not even hear you. Okay? Be personal. Okay, use a nice, typical inside voice with them. Make sure that you're at their eye level. You don't want to embarrass them in front of a lot of people. Coming within 3 feet at eye level, speaking in a voice that the two of you can hear, there's a lot more to reduce distractions. Also, make sure there's no phone, TV, radio, something blaring immediately there. No tablet. Either that thing needs to go out of the room, or you need to deliver the direction to the child in a different room so those distractions are reduced. Okay, what's number 3 in the 7 steps to following directions? Say the child's name at the beginning of the direction. It sounds very simple, but it's very important to intentionally verbalize that child's name. Let's say it's Johnny. Johnny, please go put your dish in the dishwasher, or please go put your bowl in the sink. Always take the child's name first. Why is that important? It gets their attention. If any of us are in a crowded environment and someone calls us by our first name or by our nickname, we stop and we look, and all that background noise gets cut out. It's the same thing. Your child might be focused on this or thinking about that, and when you use their name or their nickname, you cut right through that background noise and get their attention. What is the 4th step of the 7 steps to following directions? Say please and or use a respectful tone of voice. Okay, why is that important? To model respectful interaction. We want our child to learn respectful interaction, so we have to be the model for them. Okay, we have to teach them, if you want respect, you have to give respect in order to get respect. Okay, when we say, Johnny, please put your bowl in the sink, we're being respectful, we're still having an authority, but we're teaching them a respectful way to communicate that authority. Rather than yelling and jumping up and down and kind of throwing a tantrum ourselves and then wondering why our child might engage in a tantrum. We have to model respectful interaction and teach them that you have to give respect to get respect. We're the mature adults. They're the child or youth with a disability or disorder. It's on us to be that model, all right? They're a child, they're a teenager, they have a disability, so we're the ones who have to be mature and teach and model the appropriate way to do it, rather than just waiting for them to do it on their own. What is the 5th step in the 7 steps to following directions? Verbalize the specific action or behavior you want your child to do. Be exact and to the point. Keep it specific, short, and sweet. Johnny, please go upstairs and start running the hot water. Johnny, please take your lunch out of the refrigerator and put it in your backpack. Very short, very specific, and very sweet. All those things are very different than, okay, get ready for school. All right, get ready for bed. We need to take it kind of step by step and be very specific. We want to focus on start commands. Tell the child exactly what to do. Okay, you need to start. You need to turn the TV. Johnny, please turn that TV off and start brushing your teeth. Johnny, right now you need to turn that TV off and go to the bathroom and change your pajamas, something like that. We want to stay away again from those stop commands. If all we do as a person that act as a stimulus that says stop, 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 don't, that hurts our relationship with our child. That makes us just a kind of giant walking negative stimulus for them. It makes them less likely to follow directions. That really takes us again away from the direction we want to go. And while we use those start commands, takes us in the direction we do want to go. So focus on start commands that are specific, short, and sweet. What's the 6th step? Having our child repeat that specific direction back to us. Not in a disrespectful way, but in a sort of mutual understanding way. Okay, Johnny, just to be sure we both understand, what did I just ask you to do? Or, Johnny, just to make sure that you're listening or that we understand each other, can you please tell me what I just asked you to do? Something so that they're verbalizing it back to us. We want to avoid disrespect, sarcasm, those types of tones when we're using this number 6 step, because otherwise that just negates everything we just did. Again, we're modeling respect and we're trying to communicate. We just want to make sure that we're both on the same page about what the direction that was given actually said. And finally, number 7, follow through. You have to give a positive or negative consequence if you want to see a change in your child's behavior. It has to be non-negotiable, okay? When your child made their choice to comply, they also chose to receive a positive consequence or a reward that you're going to give to them. But when they chose not to comply, they already chose that negative consequence or punishment that you're going to give to them. it's not negotiable at that point. Their behavior was their choice, and it's up to us as the adult, as the parent, as the teacher, as the authority figure to use that positive or negative consequence to help teach them that we want to see that compliance continue, or we want to really see that non-compliance decrease. Again, we also want to say what we mean and mean what we say, so that when we do speak, we're making sure that our authority means something. Otherwise, we just make empty threats. I'm going to ground you for 3 months. I'm going to take away the car. I'm going to, make sure you don't see your friends for the whole month. Those are empty threats that just undermine our authority because we can't follow through, and they make our commands less meaningful. So I would say number 7 is the most important step. We have to follow through. Otherwise, all the words that came out of our mouth in steps 1, 2, 3, 4, 5, and 6 become meaningless. So again, we need to make sure we always end with a positive consequence, some type of reward, or a negative consequence, some type of punishment. So, we get to the final set of slides, the important questions that we want to answer together before the next lesson begins. This is pretty simple. What can you briefly name and describe the 7 steps to effective directions? Just name the step and give a brief 3, 4, 5 word description. Okay? Once you're done, call me over if I'm at your house or in your classroom. We'll work on it together, but it's important that you have this kind of concept down before we go on to the troubleshooting piece that's going to be the next video. What's going to be part of the next video? Just helpful details, tips, and resources to strengthen or enhance effective directions, or the 7 steps to following directions. We know that if you're following these 7 steps, that if your child has a disruptive behavior disorder, ADHD, ODD, those types of things, then they should be following directions at least 6 out of 10 times, if not more, when you're using these 7 steps correctly. If your child doesn't have a disruptive behavior disorder and you're using these 7 steps correctly, they should be following directions 8 or 9 out of 10 times. So, if those things are not happening, we have to look at those 7 steps and make sure we're implementing them correctly. If we are, we'll go over some corrective strategies in the next video to make those 7 steps even stronger. So, as always, I like to end with remembering the 2 big buts. Number 1, your child's behavior is not your fault, but helping to correct your child's behavior is your responsibility. We're the adults, it's our responsibility to teach them and to correct them. Number 2, if you want the same thing, just keep doing the same thing. If you want non-compliance to continue, you want arguing to continue, you want negative relationship with your child to continue, just keep doing the same thing. Give directions how you're giving them now. But if you want something different, if you want a better relationship with your child, if you want more compliance, if you want them to follow directions and mind what you're saying and listen to what you say, then you need to do something different. As always, that choice is yours, and I'm here to help you do it if you so choose. This is Dr. Barnabas. Thank you for watching, and I'll see you soon.